Hello friends, this is a channel which gives you useful and correct information about disease, diagnosis and treatment. And I try to give you important information about disease so that you can understand the facts about the disease and you can come to a diagnosis. And today I'll talk on the clinical features of tuberculosis in children. Let's start friends. When a child is having a disease, the parents become very anxious, and this is very natural because the child cannot express his problem. And any disease, it is true for any disease. But in case of tuberculosis, what happens is the typical features of tuberculosis, which usually are seen in adult, are not seen in child. So in that case, both the parents and doctor might get confused whether the patient is having tuberculosis or not. In case of adult, what happens is the typical symptoms of tuberculosis like cough, sputum, expectoration, then loss of weight, loss of appetite, even rise of temperature, fever, malaise, all these features are there. But on the contrary, in case of children, these typical features won't be there, and very few child will complain of cough. Otherwise, other features of tuberculosis will not be seen in children. So in that case, doctor has to decide whether the case is tuberculosis on the basis of the history given by mother and on the basis of his clinical skill, on the basis of investigation the doctor will do. Like the doctor has to be very cautious and he has to be very judgmental, because when the child is diagnosed as tuberculosis, he has to take the medicine for a long time, usually for 6 months. And the medicine which are given in case of tuberculosis, the antibiotics, they are having lots of side effects also. If the baby is not having tuberculosis and the antibiotics are given to the child, then in that case the child will suffer from lots of side effects and lots of problems. So in case of diagnosing tuberculosis in children, the doctor has to be very judgmental and very specific. So here I'll tell you few things which are very important in case of diagnosing tuberculosis. The clinical features are not typical as an adult. So what are the things we have to consider before diagnosing? The first thing in chest X-ray is there will be Hilar Lymphadenopathy in case of child. Mostly it is unilateral Hilar Lymphadenopathy and mediastinal lymphadenopathy. This is the most common feature in a child. See, in adult the most common feature is cough, but in case of child the most common feature is X-ray finding. Next is there can be primary lesion or there can be small opacity of around 3 cm diameter in the chest X-ray. The next is, the third feature is there can be opacity along with lymphadenopathy. There will be opacity in the lung, in the chest X-ray, and also lymphadenopathy. Next or fourth point is in chest X-ray you can find lobar pneumonia or segmental pneumonia, which is a almost heterogeneous or homogeneous opacity in the lung, either right side or left side, and this opacity will be pneumonia, and this is because of tuberculosis. The next or fifth point is the hilar or mediastinal lymphadenopathy causes compression of the bronchus supplying the lobe of the lung or segment of the lung. Because of that, the compression over the bronchus is obstructed, and the distal part, the lobe, it get collapsed. So there is collapse of lung. And then the sixth point is there is very less chance of cavity in case of children. So non-cavitary lesion leads to sputum negative pulmonary tuberculosis. So remember, sputum positive pulmonary tuberculosis is very less in case of children. Seventh point is there can be acute disseminated post-primary tuberculosis like miliary tuberculosis and meningeal tuberculosis. These are common in children. And the last most important point is pulmonary tuberculosis is less common than extrapulmonary tuberculosis, and extrapulmonary tuberculosis like tubercular lymphadenopathy, then pericardial effusion, pleural effusion, and tuberculous meningitis. These extrapulmonary tuberculosis are common in children. And these are the most important few points you have to remember before diagnosing a patient with tuberculosis, I mean a child with tuberculosis, because once you diagnose tuberculosis, the baby has to take the medicine for 6 to 8 months, then there can be some side effects also. And moreover, this tuberculosis is still a social taboo in our society. So that's all for today. Thank you for watching this video. I hope you would like this video. If you like this video, please click the like button. Thank you.